Hi everyone, I'm Dr. Coulter, and today we're going to talk about a topic that affects millions of people around the world, and that's blood pressure. So I want to try to define what blood pressure is. And blood pressure is the pressure that really is going through your arteries as your heart is pumping. There are two components when we talk about blood pressure: your systolic, which is the top number, and your diastolic, which is the bottom number. And when we put both of those together, that's when we look at totality, what your blood pressure actually is. So when we define hypertension, which is the medical term for high blood pressure, we're looking at particular numbers. Stage 1 hypertension is anything 130 to 139 systolically and 80 to 89 diastolically. This has been a change because in previous years, we used to say that high blood pressure started at 140. Well, now that's stage 2 hypertension. Anything 140 or higher on the top, which is your systolic, or 90 or higher on the bottom is considered stage 2 hypertension. And that's how we define it. So why do we worry about blood pressure anyway? What are the risks associated with it? Well, blood pressure can do a lot of things, and we tend to call it the silent killer because most people don't even feel symptoms until something bad really happens. Well, we don't want to wait until that point. So high blood pressure can do a lot of things to our body and affects all of our organs. But one of the biggest things that it does is it can lead to cardiovascular disease, which we call heart attacks. It can cause a stroke. It can cause people to have kidney disease where they require dialysis, and it can even cause dementia. So when we're thinking about totality and why we really want to control blood pressure is because we want to make sure that all patients live a healthy life with longevity. And we don't want you to have these complications. So it's very important that at least once a year, you're seeing your doctor for your annual physical where someone's checking your blood pressure. And then also there are many ways that you can check on your own. Order your own blood pressure machine or stop at your local pharmacy and just get your blood pressure checked periodically. So what are some things you can do to help control your blood pressure? Well, these are simple things: eating a healthy diet, exercising on a regular basis, decreasing your salt intake, decreasing your alcohol intake. These are some things that will really help in maintaining your blood pressure on your own. There are times though where even when we do all of these things, it may not be enough. And that's where medications come in. So I tell people, don't be afraid of medicine if it's there to help you and help to maintain a healthy lifestyle, especially if it's going to help you live a longer life. There are some people who can do it with lifestyle modifications, like I mentioned, and there are some people who need additional help. If this is you, if you're a person who suffers from high blood pressure, make sure you schedule an appointment with your primary care doctor to be evaluated, and make sure you do something in advance so we're preventing those complications because we all want you to live a long, healthy life. If you have any questions about your blood pressure or if you want to be checked, give us a call here at the office. It's 832-619-1669. We're here to schedule an appointment for you to be evaluated.